Do it.
Yeah,
Okay, this is Esther Nachi. She's been a patient of mine for almost a year now.
yeah, 8 months.
And you were diagnosed then with?
Stage 4 pancreatic cancer.
Okay, and 2 weeks ago we did your first Seqex treatment.
Yes.
And we used the spot probe
Yes.
on a number of locations.
Mm-hmm.
Tell me the experience with that.
We did the pancreas area. We did where my cyst is in the front, and where my kidney and the cyst abuts up against the kidney in the back. All kind of sore areas. And within 48 to 72 hours, my intestinal tract and these areas felt like they were settling down. Along with my condition, I have ascites, and I have had it the whole time.
And ascites is water on your abdomen?
It's basically a proteinaceous fluid where the body thinks that it's doing you a favor by creating this fluid and incubating the cyst and trying to bring the body into homeostasis. And basically it just accumulates, and my oncologist was gracious enough to grant me a catheter so I can drain my own fluid periodically at home. And after this treatment, not only did I feel better, the rate of fluid accumulation is reducing. I'm allowed to drain every 4 days, 500 milliliters, and being the person I am, I push the envelope just a little. But my last draining session, which was 4 days ago, I had trouble draining fluid off. I had to stop periodically because the catheter was sucking against the insides because the fluid wasn't like right there readily available to drain out. So I am cautiously optimistic and very happy that Dr. John has this treatment, and I have decided to be a little bit more rigorous in coming for visits once a week, and hopefully with this treatment we can get the body to say no to building up the ascites and get the tissue and the cells around the cyst and in the body and the affected areas to straighten out and start healing on their own.
And your abdomen right now, it does look a little swollen, but
It is a little
that
bit.
is lower than I've ever seen it since I met you.
Yes, I mean, imagine this, lovely, 6 months pregnant. You know, I came here back in May of 2017, where they would do paracentesis, which is making a little cut and draining the fluid out. You know, with my belly being that distended, they would take roughly 5 or 6 liters off at a time, and in a 10 to 14 day period. So I am like nowhere near that now. I barely got my 500 milliliters the last time I drained, and going forward I'm going to have to figure out how to tell how much fluid is in there so I don't waste resources, you know, because my bottles are a little difficult to come by.